health experts have raised concerns over the low vaccination coverage. They say the resurgence of vaccine-preventable diseases in the country is due to immunity gaps that were further impacted by the coronavirus. The Health Committee of South African United Business Confederations, Dr. Angelique Coetzee, joining us now to give us more information around, in particular, these diseases that are preventable. Doctor, good morning to you. Talk to us about a resurgence of these that could have been easily dealt with had vaccine campaigns not died down.
Good morning, and good morning to all your viewers out there. Yes, I think we also need to take into account that for the past 20 years, there has been an increase, especially in the cases of Bordetella pertussis, or whooping cough, as it is commonly known. And, although there's an increase in these diseases, it might also be due to the fact that a lot of the doctors are more aware of this disease. There are better serologic markers for identification that we can see for this. We also need to understand that there are more asymptomatic carriers, especially of Bordetella pertussis, which is not a virus, it's a bacterial infection. And then, unfortunately, the vaccine waning, or the waning of your immunity, as well as vaccine hesitancy that we are currently seeing. And this is especially the vaccine hesitancy, very of a huge concern around your measles, your pertussis, and your other diseases which can be treated or being prevented to a very, very large degree by vaccinations.
Yeah, you talk about vaccine hesitancy. I want to pick up on the measles outbreak in the country and the spread of this. It's quite clear that this is one of those preventable diseases if people were to be vaccinated. And so the question is, what lies behind the spread?
So, again, as I've already said, maybe better diagnosis and all of that I've already mentioned. But we have seen that vaccine hesitancy, even before COVID started, it became quite or contribute towards the declining in your vaccination rates, especially in your low and middle income countries. So it's not only COVID, but it's pre-COVID also that we started to see this. And then I think what is important is that there's a lot of misinformation out there, especially by the anti-vaccine people there. We have seen the political polarization in vaccines, in the attitudes there during COVID, also eroding the confidence in vaccines. And then what we also see is that parents are more likely to vaccinate themselves than to put their young children, who is actually at greater risk of mortality, especially with measles, to get them to be vaccinated. So that all of that plays a role. And again, I think it's so important that the media, especially programs like your programs in channel Newzroom, to get the message out there, the importance of vaccination. This is preventable diseases. Also, what we have seen with whooping cough, that is the children that's the most affected is the ones that is under 3 months of age. Yeah. Those children are really very, very sick when they get to whooping cough.
Yeah. Yeah. And as we wind down our conversation, Dr. Coetzee, let's then talk about the steps that can be taken to close these vaccination gaps. What kind of messaging needs to get out there?
We need to educate the people. We need to get the clinics to vaccinate. We need to make sure that there's no stock outs. We need to to drive the awareness that the diseases for childhood vaccination, if you don't get your vaccines or give your children, allow them, the babies and the young people with these to get vaccinated, they are at risk of higher mortality going forward. We need to make sure that parents understand this. And then these vaccines has been around for many, many, many years. It's not like the same that we have seen during COVID, where some of these vaccines was quite new that's on the market. So there should not be vaccine hesitancy there. You should go and get your child being vaccinated.
There may be parents at this time who are wondering, okay, so my child has missed this or that vaccination. Can I still go back and get them vaccinated? Those kinds of questions.
Yeah. You can. And I think if any clinic or any doctor show you a way, it is important that you report it. Report it to the newsroom, report it to the social media, because no child that had missed their vaccination should be turned away. You should go and you should catch up with your vaccines. That is very, very necessary. And with whooping cough, you need your vaccines at 6 weeks, 12 or 10 weeks and 14 weeks, and then a booster at 18 months. And also to understand that, again, the children that's the most at risk for whooping cough and measles are your young children, especially under the age of between 3 months for whooping cough and under 6 months for measles.
And the role that can be played by the Department of Health here, Professor Coetzee, do you think that they are playing that role right now, or is it left to people like you to try and drive out this message that campaigns around catching up on vaccinations is actually necessary?
So yes, and I'm unfortunately not the professor I would like to be one, but yes, it is so important that the National Department of Health also have their campaigns. But in the end of the day, what we see, it is, again, your channels, your television channels and your radio stations. It's the media out there that's actually doing most of the work. And for that, I congratulate you all, and especially Newzroom Afrika, because you are quite up to date with these vaccines and the problems that's surrounding it. And thank you, because without you guys, we're going to miss the boat, and we cannot afford to miss the boat with vaccinations.
Dr. Angelique Coetzee, let me thank you very much for your time, and very, very important message indeed. Let's get out there and get vaccinated. In particular, the children. Preventable diseases are killing people, and this is something that is totally preventable.